Hi, I'm Allison, and this is Jessica. We're going to be going over some postural corrections we can make to alleviate or hopefully even eliminate lower back pain. So we're going to start out looking at, and I know this sounds a little nitpicky, but it's very important, how that we hold our thigh bones in the hip sockets. So for most women and a lot of men too, there's an external rotation in the thigh bone. So if you look here, if you can see, even Jessica's feet are turning out a little bit. So it's subtle for her. For a lot of people, it's more pronounced. But if she makes a little shift here and she just, from the thigh bone, she starts to turn them in from the hip sockets. See, her feet got more parallel, okay? And then if we turn Jessica around, we can see how that affects the lower back. So she turns the thigh bones in from the hip socket, and then what she needs to do is just draw the pubic bone up a little bit in the front, and then she gets a lot more lengthening, and even a little bit more. Yeah. So then this whole area got a lot more spacious. So instead of being compressed, it's more open. And that will, the compression a lot of times is what causes the pain. So very good. So if she can rotate the thigh bones in at the hip sockets, and you see how that just moved her feet more parallel, and she's going to spread her toes, and then she's going to be pressing onto all four corners of her feet. So the big toe mound, the pinky toe mound, and the inner and the outer heels, she's going to press evenly through those points. And then at the same time, she's going to draw the arches of the feet up, both the inner and the outer arches. And this might sound like a lot, but she'll feel a nice energy coming in through her legs, and then that helps her get more aware in how she's holding her pelvis. So then the pubic bone can draw up and the tailbone can slide down a little, and that's going to give her lower back a lot more stability and a lot more space. So Jessica is lying down here for an exercise we're going to do to strengthen the ability, really, to turn the thigh bones in the way that we're working on today. And what you need is one of these yoga blocks. And if you don't have a yoga block at home, any kind of object that's similar, you could probably even use a foam roller if you have one of those. Blocks, by the way, are very inexpensive. If you want to get a set, they're very helpful. So we're going to put this between her thighs so she can hug her thighs into it. And then if you notice, her feet are hip width apart, so you can tell if your heels are lined up with your sit bones. Her feet are parallel, okay? And her knees are hip width distance apart, all right? And she's going to press into all four corners of her feet. So if your weight is more on the outside or the inside, try to alleviate that by pressing evenly on the outer and the inner foot, both at the toe level and at the heel level, okay? Her arms are by her sides, her palms are facing down. So she's going to press the thighs into that block as she slowly lifts her hips up. And she's going to press her thighs into the block as she slowly lowers her hips down. Good. And she'll just do that 3 more times so you can see this is something you can at home do about 10 times at a time, 10 times at a time. And if you'll notice, she's lifting at the same pace as she's lowering. She's continuing to hug into the block. She's continuing to press into all 4 corners of her feet so her weight isn't going in or out. Good. You've got to use abdominals as you lower down, right? And then pause. Good. So you can do that about 10 sets at a time. If you start to feel fatigued before that, then you should stop. You know, it's always alterable depending on your level of ability. So there are a couple of ways that you can train your body and strengthen that habit of the internal rotation. And one of the ways is using a yoga block. If you you don't have a yoga block, if you have something in your home that's about this size and is relatively firm, you can use that. So we're gonna put the block, first of all, Jessica's lying down, right? Her feet are parallel, and they could be a little wider, I think, just a teeny bit. So you want your feet about as wide as your hips, and you want your knees as wide as your hips for this. And then we're gonna put the block in between her thighs, and she's gonna squeeze into the block. So squeeze the block, press into the feet, lift the hips slowly, and lower the hips slowly, and squeeze the block on the way down. So all this is training her thigh bones, and it's also strengthening her lower back. So do that just 2 more times. Lifting slowly, squeezing into the block, lowering slowly. You have to use the abdominals, obviously, as she's lowering down. And 1 more time. Press into the feet, lift, squeeze the block, lower down. So those thighs will get very lazy. You have to really make a conscious effort to squeeze the block as you lift and as you lower. So now the other thing that you can do that's good to stretch and strengthen the lower back, it's a little less active. She's going to keep the block here, and she's going to bring the knees into the chest. Open her arms out into a T shape, and you can have your palms facing up. And then she's just going to let her, and you can have her up, because it's more relaxing for the shoulders. And she's just going to let her legs go over to the right. And they're going to be relaxed. They can go all the way down. And so this is just to help that top thigh hug into the block a little bit. And it's subtle, but it's really potent. What it does is the right side, or the left side now of her lower back is getting a little stretch, you feel? And it's going to get more spacious, okay? So you can come into this shape, and then she can just take a few deep breaths. So she's breathing in through the nose, and she's breathing out through the nose. Good, breathing in through the nose, and out through the nose. Good, and as she does that, the muscles start to ungrip. So if there's any gripping, as she holds this position and she breathes slowly and deeply, that muscle tension has no choice but to let go at least a little bit, okay? Good, Jessica, so come back to center. And then we'll just let her go to the other side so she's even. Good. So again, she's hugging this top thigh into the block gently, gently. So the legs are pretty relaxed. And then the opposite shoulder is relaxing. So if you're doing this at home, make sure you're not tensing up that opposite shoulder too much. And then she's gonna breathe slower, deeper, longer breaths. So when you're doing this at home, if you can just slow your breathing down from its normal pace, at least a couple of counts, you'll be fine. So you're taking a slower inhale and a slower exhale. Good, and I'd say if you do this for about 10 breaths on each side, that would be a good amount of time to really give that area an opportunity to release. So as you can see, we've come over to the wall for a pose called Viparita Karani in yoga terms. We basically take our legs up the wall. So what you're going to want to do is, and you can do this in your home wherever you can take your legs up, you just scoot up one hip as close to the wall as you can, and then you guide your legs up as you lie down. And sometimes she got pretty close. So you can see how she had to scoot in a little bit to get her sit bones flush with the wall. If you have tight hamstrings, this might not be, you might need to either keep your knees bent, so she could just slide her heels down a little bit, or this may not be the right pose for you. You're better off to lie down in front of a coffee table and let your calves rest on the table or chair or something like that. But if this does work for you, this is a really great position to just release a lot of pressure in the lower back. So her palms are up, her arms are away from her sides a little bit. She's just going to let her eyes close. Her feet are relaxed. And then we're going to do a little bit of just what's called samavriti, or even breathing. So it means that her inhale and her exhale match in length and intensity. So she can count mentally her inhale to probably, what, a 4 count? Yeah. 4 count inhale and a 4 count exhale. And you can do this at home, and almost everybody can do at least 3 counts. Some of you may be able to do a longer duration of breath. And she's breathing in and out through the nose. So this is very calming to the nervous system. It's going to help her release tension in the lower abdominal area. The weight of her thigh bones sinking down into the hip sockets is helping the lower back spread a little bit. And you can stay here for anywhere from 1 to 15 minutes. So then when you're finished, to come away from the wall, you blink your eyes open, you bend your knees, and then roll to one side, and just gently press yourself up. Scoot away from the wall, and you're done. Good. We hope this helps you find freedom from any kind of pain or discomfort you might be having in your lower back. Namaste.